I am Dr. Parsa Mohebi, Medical Director of U.S. Hair Restoration. The topic of this webinar is going to be female hair loss treatment. That we call it 5-step approach or 5-step method. Female hair loss is a situation that might be significant in many cases, and bringing patients to physicians, and in particular to hair restoration doctors. The approach to female hair loss might be a little bit different than male pattern baldness. Some women may need some more diagnostic or more lab works before we can confirm the diagnosis and start doing the treatment. In short, I put it in 5 steps, so that makes it very easy for most physicians to follow and to be more organized with their diagnosis and treatment of hair loss in females. The first step is history of hair loss. Second is macro and microscopic evaluation of hair and scalp. Number 3 is diagnostics, that we will discuss more. Number 4 is to come up with the proper diagnosis, and number 5 is hair loss treatment. We're going to start with the first step, which is history of hair loss. It's very important for every physician. Actually, this lecture might be more interesting to physicians who are dealing with hair loss situations. That's a good review of hair loss evaluation and treatment in female with hair loss. Step 1 is history of hair loss. Every doctor should ask about family history of hair loss. A lot of women are having someone in their family members, immediate family members, female members, who are having similar patterns of hair loss, because female pattern hair loss in many cases is genetic, and we should find some sort of connection with other family members. We also have to ask about other medical problems that some women may have, and some systemic medical situations are causing hair loss in women. Medications that they're using, some medications are causing hair loss, and also we should ask about the medication that people used for treatment of hair loss, and how successful they were, and how and if they stopped, why they stopped it, and whether or not they had any side effects. The second step in treatment, the diagnosis of female pattern hair loss, is macro and microscopic evaluation of hair loss. Obviously, when we see people, as soon as they step in, we can know what kind of hair loss they have grossly, and we know whether or not this is like a typical female pattern hair loss, or is a male pattern hair loss in a woman. By doing microscopic evaluation, we get more information. This test is called a miniaturization study, that we use a microscope to see what's the fineness of these hair shafts, because before people lose their hair permanently, they have some other steps that are showing finer hairs in larger area of the scalp. And when we see a lot of fine hair in different areas, it means that people are actively losing their hair, and that's kind of predicting the future of hair loss. And that's something that we can basically choose as a prediction of pattern of hair loss in the future. Whether or not people need surgical treatment, we can use that to know what kind of planning we have to do, and do they need medical treatment in addition to that or not. Next step 3 is diagnostics. We need some lab works. Many women who are showing diffuse hair loss, they need to get some lab works done. CBC blood, cell blood count is very important to see whether or not they have anemia. Serum iron levels, TIBC, and ferritin, those are the lab works that are showing the iron levels and iron balance of in patients. Hormonal evaluation. Many hormonal situations may cause hair loss in women and men. The most important ones are total and free testosterone, DHEA, prolactin, thyroid hormones, and other than those, we have some other lab works that are to evaluate the other diseases like lupus or rheumatoid arthritis and those type of medical conditions. Those are important for people who are also having other systemic diseases that may have hair loss as one of their presentations. Eventually, some people may need a scalp biopsy to see their skin under microscope and come up with more precise diagnosis. Step 4 in management of female hair loss is to come up with a diagnosis whether or not women have female pattern hair loss, which is usually presenting itself as a diffuse hair loss all over scalp, and these people are usually not qualified for hair restoration surgery, or if they are, they cannot expect as much as the other groups. These people may have medical conditions. We have to spend more time to find out if they have other medical conditions, especially if they don't have any other relatives with the same hair loss. Women with male pattern hair loss are women that who keep their hair on the back and sides pretty healthy, but they lose hair on top and crown. That is basically the situation that could be seen in people who have elevated testosterone. So these women are already having gene of hair loss, but it doesn't show itself unless they have that elevated testosterone that may cause hair loss in its male pattern. And also women that are congenitally losing hair and congenitally having a hairline similar to a male hairline. Treatment for female pattern hair loss is the last step in the approach to female hair loss. Medical treatments, obviously, we have several treatments. The most important one for women is Rogaine, that is over the counter. Everybody can obtain and start using. I do recommend that you see a hair restoration doctor to tell you whether or not you need Rogaine. Many people, despite of having hair loss, they may not need Rogaine, or Rogaine may not be even helpful. So a lot of these people start Rogaine and keep using Rogaine without even needing it. Laser is the other option that some people recommend and some people have, and cosmetic changes are the other recommendation that we usually have for the patients. This is a female with female pattern hair loss. A woman with frontal hair loss. This is not a typical female pattern hair loss, as I discussed. It's more of a combination of female and male pattern hair loss. So this lady has all frontal areas of the scalp transplanted. This is right after surgery, a little bit bruising, a little bit redness, but I assure you that it's not going to be as painful as it looks. This is 6 months after procedure. The upper pictures, the lower pictures is like 10 to 12 months after procedure. You see hair pretty much growing and covering the balding area. And in next picture, you see the balding area as opposed to 10 months after. I think it was 10 months after hair transplant that this patient has resumed his pretty much full head of hair. That was it for management 5-step approach to female pattern hair loss.